Better health. Can we talk? Those words made famous by Dr. Ruth, who wanted women to talk more about things we are uncomfortable with. Women may have gotten more comfortable talking about the bedroom, but when it comes to matters of the bathroom, lots of ladies are staying mum about very common problems. And one of the biggest problems facing middle-aged women, accidents. And we don't just mean number one. Something called fecal incontinence is very common, and most women don't know there's a solution that can cure it. We went to a local female doctor to open the door to conversation she says needs to be had.
I was having accidents, which you don't want to talk about, and I'm very physically active and busy, and I just was mortified.
Elizabeth Doyle is a special ed and high school English teacher who couldn't leave her kitchen last year.
I literally would get up in the morning and just stay in my kitchen, and then I have a little half bath right off the kitchen so that I could get my daughters out the door to school and only be a couple of steps away from the bathroom.
She just couldn't live that way anymore.
I finally mustered up my courage to come into the office.
Elizabeth came to colon and rectal surgeons of Greater Hartford and Bloomfield, where Dr. Amanda Ayers knows all too well many women are suffering when they don't have to due to embarrassment.
I can't tell you how many women come to me and say, oh my gosh, I'm so glad there's a woman that does this because I haven't talked to anybody about this and I've been dealing with this for a really long time.
Women, I have to imagine, don't want to talk about what doctors call fecal incontinence.
Yeah.
First of all, what is that?
So often the lay term we use is accidental bowel leakage. So it can mean a lot of things to different people. It can mean leaking a little bit of stool on a pad. It can mean having accidents, the grocery store. It may mean significant urgency where you have trouble getting to the bathroom in time.
Women suffer more than men, usually because of childbirth.
When women have a vaginal delivery, sometimes they have large babies. They may have to have an episiotomy, or because the baby is larger than expected, end up having a tear. That tear can actually go all the way through and rip what we call the sphincter, the control muscle.
My first daughter was very large. She was almost 10 pounds, and so it was a rough delivery, which is what got me to having a problem.
The good news is you don't have to live with this.
That's right. We have a lot of treatment options, which can range from very simple dietary changes, exercises, injection therapies, and a newer therapy called InterStim.
InterStim is a small device that's implanted surgically at the base of the spine, and it's changing lives.
Essentially, the full implant is almost similar to a pacemaker. It sends a very small electrical signal to the nerves that control the bowel and the bladder to help both the nerves and the muscles squeeze better and reduce rates of both urgency and accidents. So this is what the generator looks like, and this is the small little wire that we talked about going into that hole through the bone and contacting these very small yellow nerves.
So I went home and researched it, and I was like, I so want that because it's amazing.
Amazing because InterStim is covered by insurance and the results are rapid.
We'll know usually within a week. We define success about patients having 50% reduction or more in their symptom frequency.
Do you see some people get just totally better?
Yeah, the data suggests about 25% of people are going to be 100% perfectly continent.
This is safe? It doesn't hurt once it's in?
Correct, yeah. People live with this all the time. They don't notice it. They perform normal activities, yoga. I have patients who kayak.
Now Elizabeth just stays in the kitchen when she wants to enjoy tea. She's back to doing hot yoga and even taking early morning flights with no problem.
It is really, truly life-altering, and I feel very, very grateful to this office for allowing me the opportunity to have this change, because now I feel back to normal.
Dr. Ayers knows a lot more women could use the help.
It's more common than both Alzheimer's and osteoporosis in the U.S. population.
Do women tell you that they've actually thought about trying to talk to their other doctor, but because he was a man, they just couldn't?
Absolutely. I would say 90% of the women I speak to tell me that.
The temporary testing device takes about 20 minutes to insert. You go home and see if it works. It's like a no-risk trial before the permanent InterStim device is surgically implanted.
Yeah,
so it's working?
It's working really well.
Okay.
Yeah,
Tell me about what things you've been able to do in the last couple weeks that you couldn't do before.
Well, I've been able to actually change my morning schedule so that I don't have to just wait in the kitchen and feel like I'm going to have an emergency.
As long as we're getting the answers to your most embarrassing problems, what about hemorrhoids?
Creams and ointments will manage the symptoms only, but they're not going to treat or cure the hemorrhoids.
And there are medical treatments covered by insurance that will actually cure them?
Yes.
And
Any rectal bleeding should be evaluated by a physician, both because it may simply be hemorrhoids, but to ensure that there's not other reasons that you're having bleeding. Anything that's been persistent, any growths or anything you feel like with cleaning that have persisted need to be evaluated by a physician as well.
Still have more questions? Elizabeth says, what are you waiting for? And you wish you would have called sooner.
Oh, years sooner. Years sooner.
Dr. Ayers is available for a consultation at the Colon and Rectal Surgeons of Greater Hartford. They do have offices in Bloomfield, South Windsor, and Plainville, and we have a link on our website, betterct.com, so you can get in touch.
All right, imagine